Death is an inevitable part of human existence which most people prefer not to think or talk about. It's the end to a lifetime that leaves people around bereaved and wishing to turn back the hands of time. One notable question people often ask is, what happens when you die in your sleep? As much as this is a very controversial way to die, especially for young people, an autopsy is usually conducted to identify possible causes of death. Now, it is important to note that people do not just die in their sleep. There are factors that could lead to death during sleep. In most cases, the dead may have seen signs but ignored them as usual medical illnesses. This hasty and unfounded conclusion is the reason there's a high rate of death during sleep. Factors that can cause death during sleep. Death comes as a result of some external factors which may either be from the immediate environment or an outside agent. For instance, someone can die in their sleep if there is an earthquake and the building housing them collapses. Also, if there's a poor heating source or faulty ventilation, it could lead to death as respiration is being tampered with. Cases of homicide can also be recorded during sleep, and this could also affect the person involved. Now, let us look at the most significant causes of death during sleep. 1. Heart failure. When one is dying or at the risk of dying, most systems are found to be failing. Most times, it is the failure of the lungs and heart that leads to death. When someone dies and an autopsy is being carried out, it is important to look at both interrelated systems as they contribute a great deal. A respiratory failure affects the function of the heart, and this could also affect other systems depending on the heartbeat. An acute cardiac malfunction affects blood passage to the brain and often leads to very fast respiratory failure. The lungs also get filled up with fluid in relation to pulmonary edema, which usually occurs during heart failure. 2. Cardiac arrest. Most times, there's usually a shred of reasonable evidence that indicates the cardiac function might have been stressed during sleep. Rapid eye movement (REM) sleep redlines the system with increased risks towards the morning. There is also a circadian pattern in cardiac dysfunction which has problems occurring later at night and near awakening time. Heart attacks usually happen when the blood vessel which supplies the human muscle tissue gets obstructed, leading to the damage. The myocardial infractions range from minor occurrences that compromise functions to bigger blockages which lead to the complete failure of the heart. If blood circulation is blocked, the other systems of the body fail, and this is the time death occurs. The heart is also inundated with irregularities that affect the electrical system. The charge required to increase the muscle fire may be disrupted. The contraction becomes irregular, either very fast or very slow, and the effectiveness of the heart pump might be compromised. 3. Arrhythmias. This is also a regular cause of death while sleeping. An asystole is a form of cardiac arrest rhythm which makes it difficult for the electrical activity of the heart to be detected. Atrial fibrillation or flutter undermines cardiac function. Other ventricular rhythms which include tachycardia are likely to become fatal. Also, cardiac blockages that affect electrical patterns might also lead to heart dysfunction and death. 4. Chronic and congestive heart failure. This also leads to the failure of the heart. Left-sided heart failure quickly impacts the right side of the heart, which leads to accumulation of fluid in the lungs, breath is shortened, and the swelling of the feet and legs, which is called peripheral edema. In the event that the heart is experiencing volume overload, its ability to enhance blood circulation may cease. Notably, the heart will also affect other systems relying on it to circulate blood. An irregular rhythm leads to a clot that moves to the brain, thereby causing a stroke. There's also the possibility of high blood pressure or even hypertension increases the risk. When a stroke affects the brainstem, body systems that control eye opening, breathing, muscle control and consciousness are compromised. The stroke may be fatal and has the capacity to occur in sleep. 5. Respiratory arrest. It is a known fact that lungs help in completing the function of the heart, and if one system fails, the other follows immediately. Pulmonary diseases are usually chronic while the impacts develop very slowly. The reaching of a critical threshold could lead to death. At a normal level, the lungs handle the exchange of carbon dioxide and oxygen with the environment. If they are not functioning properly, the oxygen level inadvertently falls, carbon dioxide levels will rise, and fatal changes will occur in the acid-base balance in the body. Other possibilities under respiratory arrest could be an acute obstruction that may occur when you choke on vomit and encounter asphyxiation. Although this is very unlikely, the possibility exists for sleep apnea to be fatal. Respiratory failures can occur due to degenerative and chronic diseases. This can also be as a result of the failure of the lungs, like in emphysema, chronic obstructive pulmonary disease (COPD), cystic fibrosis, pulmonary fibrosis, lung cancer, status asthmaticus, pneumonia, pulmonary embolus, clot to the lungs. There's also a possibility of the lungs failing due to changes in the nervous systems or muscles, such as lateral sclerosis (ALS) or Lou Gehrig's disease, or myasthenia gravis. Additionally, there are congenital disorders affecting breathing, like the congenital central hypoventilation syndrome. The SIDS, which means sudden infant death syndrome, means an inability to breathe well during sleep. You will notice that when death is coming slowly, a mode of breathing known as Cheyne-Stokes respiration happens. It is usually observed in heart failure, injury to the brainstem, and narcotic drug usage, and indicates a cessation in breathing leading to death. Signs that show death is approaching. Few people are aware of what shows that the end is near. One thing is certain though, death is a debt repayable by every human, and like most scientists maintain, it is a process. If one has a terminal illness, one of the signs to note is the social withdrawal of the person several months before they die. The implication of this is that the person becomes disinterested in certain social activities and public gatherings. People in this category are focused on spending time with their family and dedicating time to understanding the true essence of life. They also divert their attention to things that are very important to them, and some might even end up writing books or dictating for a writer if they are incapacitated. Another indication is the exertion of less energy toward the end of life. They become excessively tired, and this fatigue can lead them to sleep more. This fatigue is caused by several factors. For instance, if the person involved is a cancer patient, the cancer cells have the tendency of consuming much of the person's energy. Irregular breathing can also cause one to have a lower level of oxygen and a higher level of carbon monoxide in the blood. This leads to fatigue. Additionally, the person will start drinking and eating less, and this is a result of insufficient calories that keeps one active. Dehydration is a major cause of fatigue. 1. Reduced appetite. Sometimes, one may experience a serious dip in appetite, which may be a result of various reasons. It could be a result of the production of more catecholamine, a blood chemical that suppresses appetite. An increased catecholamine is very common in people approaching the end of their lives, especially cancer patients. 2. Moving slowly. There is a high tendency for diminished energy, which causes one to slow down naturally. People start to move, think, and talk slowly more than they used to. They might also need enough time to process the information they get from conversations. If the person is under certain medications like painkillers, there's a likelihood that they may also slow one down. They start seeing everything as being totally exhausting. Simple everyday things like moving from the bed to a chair turn to a Herculean task for them, and this could be really bad. 3. Slipping away. When one dies, the physicians conducting the autopsy usually check for cardiac arrest or brain death, a situation when no electrical activity in the brain. If one is in a vegetative state, invariably no brain activity occurs anymore, and life support keeps the organs functioning, which doesn't last long. When someone dies in their sleep, between cardiac arrest and the brain, one of them is usually responsible for the death. Physicians do not need to go searching for answers when one dies in their sleep, as answers abound on what may have led to the death of the individual involved. If you've enjoyed this video, click the subscribe button below and hit the notification bell so you'll know once we post a new video. Also drop a comment below so we can know your thoughts. Finally, don't forget to check the description below for more details, and visit our site, www.zimsleep.com, for more awesome sleep content like this.